it's, we've often been fairly lockstep in terms, especially public policy around healthcare. And with our, the change in leadership there with RFK Jr. taking the reins, we've already seen maybe some change at the top. Maybe not down below where the science and the medical practice is, but sort of a change at the top in terms of around vaccinations, preventative measures such as fluoridation of water. We've typically been lockstep. Here, we might start to see a divergence. What is the approach that Canada is taking to ensure? Because I think we've seen some of the same questions pop up in Canada from folks. Should we be doing vaccination? Should we be doing it? So how do we address it here in Canada, knowing that there is this loud voice across the border and a lot of policy change that is potentially going to happen, at least for the next 4 years? So how are we sort of protecting ourselves maybe from that pressure?
Yeah, well, the first I would say with the lockstep, I think that's true for maybe our public health approaches, but not for the healthcare system. We're actually quite different. And the Canadian system is much more similar to our European counterparts. And even there's a lot of variety, but we're much more similar to most European countries' healthcare systems than we are to the US. They are standalone. There is nobody else in that category.
Yeah.
They spend far more money per person on their health system, and even tax dollars. They spend more tax dollars per person on their healthcare system than we do in Canada, which is baffling to me because that doesn't include the insurance costs, that doesn't include out of pocket. But when it comes to public health approaches, with the CDC, for example, and the Public Health Agency of Canada, we absolutely were quite well integrated partners. And we depended on them as a source of information, as a trusted partner, and it was a given that they would be there to share scientific information, scientific consensus, that they would be putting out messages that promoted public health. And I don't think we can trust that's a given anymore. And that is a very new environment that Canada is going to have to learn to navigate. Websites like the CDC have been scrubbed of different terms that the administration doesn't like.
Yeah.
Their data sets have been altered to remove categories of people. So information, like they had contraceptive guidelines that I know obstetricians and gynecologists in Canada used regularly with their patients. That's gone. It's not there anymore.
Mm-hmm.
So the resources that we used to see as a given in the US are either gone completely or are no longer reliable because they've been tampered with or may have been tampered with. And there's no way for me to know which data sets have been altered or not altered, but I know some have. And so we are going to have to create a lot more resources within our own borders that Canadians will be able to go to. Because I used to send people to American websites all the time to get information, and I'm not sure if I can do that anymore. So I really want to see Health Canada, the Public Health Agency of Canada, strengthen their websites, make them easier to navigate, make them trustworthy sources of information for all Canadians to go to, and also support the organizations that are doing similar work. Diabetes Canada has great information. The Cancer Society, the Society of Obstetricians and Gynecologists, they have a page on sexual health, on pregnancy, on menopause. Like, these are great resources, but we're going to have to invest more into making sure Canadians know where they are, know how to access them, because we just can't depend on our partners. I just saw a headline, I think this morning, about how the Health and Human Resources are going to be looking into whether or not fluoridation is beneficial or not. This has been looked into so many times. We've seen Canadian cities that removed fluoride, saw their dental disease skyrocket, and put it back because of that. Like, we have case studies of populations of over 1 million people where we saw the harms of removing fluoride from the water. We don't need to study this, and especially when they've slashed research funding across the board for new pieces of information, to then go and spend time studying something that we already know is so disheartening. So, if you remove fluoride, we know kids are going to get cavities, they're going to lose their teeth, and that's also linked to all kinds of other health problems as well. So this is hard to watch for the sake of our American colleagues and the American people and the harms they're going to experience. But even within Canada, we're going to have to really invest in making sure that we can provide those sources of information, because we are going to be bombarded by the messages that come across the border. We already are.